This video will help you understand the APC I1307K gene mutation and how it may affect you or your family. Your genes contain the instructions that make your body work. Every cell of your body has the same set of genes. You have 2 copies of each gene, one from your mother and one from your father. You have some genes called tumor suppressor genes that protect you from getting cancer. A gene mutation is damage to a gene. A mutation in a gene may change its instructions and cause it to stop working normally. Gene mutations in normal cells are usually inherited or passed down from parents to children. This means that family members such as parents, siblings, and children sometimes have the same gene mutation. These mutations can also develop by chance before a person is born. If a mutation happens in one of your tumor suppressor genes, you may be more likely to get cancer. Genetic testing is used to look for mutations in your cells. Here at MSK, we use 2 types of genetic testing. One type looks at the genes in the tumor cells, and the other type looks at the genes in your normal cells. When we look for gene mutations in the tumor cells, we use tumor tissue from a previous surgery or biopsy. This type of testing helps us to learn about the genes in the tumor. It also lets us look for mutations that may be good targets for treatment. When we look for gene mutations in your normal cells, we usually use a sample of your blood. This type of testing helps us learn more about your risk of developing certain cancers. You or one of your family members had genetic testing done, which found a mutation in the APC gene called I1307K. This gene normally helps protect you from colon cancer. We will now discuss what is known about the cancer risks associated with an APC I1307K gene mutation. Some genetic mutations are rare and are associated with a very high risk of cancer. For example, mutations in the BRCA1 and BRCA2 genes are rare but are associated with a very high risk for breast cancer. Other genetic mutations are more common but don't increase your risk for cancer very much. The APC I1307K mutation falls into this category. I1307K is a common mutation found in 6 to 10% of people of Ashkenazi Jewish descent. It has also been seen less commonly in people of non-Jewish ancestry. Most mutations in the APC gene lead to a severe condition known as familial adenomatous polyposis, or classic FAP. People with classic FAP develop hundreds of precancerous polyps, or small growths, in the colon. These people have an extremely high chance of developing cancer of the colon or rectum. However, the I1307K mutation in APC is a less serious mutation of the same gene. While it slightly increases your risk of colon cancer, it does not cause FAP. We don't know if I1307K increases risks for other types of cancer besides colorectal cancer. Now, let's talk about how different things affect your risk of getting colorectal cancer during your lifetime. We'll use percentages to talk about risk. In this video, percent means the number of people in every 100 people who may be affected. For example, 30% means 30 out of 100 people. In the United States, the chance that an average person will develop colorectal cancer in their lifetime is 5%. This risk increases to about 10% for those who have a parent or sibling with colorectal cancer. Similarly, the APC I1307K mutation also increases your risk of getting colorectal cancer from 5% to 10%. So having the I1307K mutation puts you at the same risk as someone who has a close relative with colorectal cancer, about 10%. This is much lower than the cancer risk seen with other mutations in the APC gene that cause FAP. People who have FAP have a much higher risk of developing colorectal cancer. Right now, there aren't any standard medical guidelines for people with the APC I1307K mutation. At this time, we recommend that people with this mutation follow the same guidelines as people who have a close relative with colorectal cancer, including an initial colonoscopy by age 40 and follow-up colonoscopies every 5 years after that. If you have a personal or family history of polyps or colorectal cancer, your doctor may recommend a different screening plan. Be sure to follow the plan that you discussed with your doctor and keep in contact with their office to stay informed on any updates. If you have the APC I1307K mutation, your children, siblings, and parents have a 50% chance of also having the mutation. While there are no standard guidelines for testing for the APC I1307K mutation, your family members may want to discuss genetic testing with their doctors or a genetic counselor. This may help them decide whether to start having colonoscopies at age 40 instead of age 50, which is the usual age for screening in the general population. Whether or not your family members decide to have genetic testing, they should follow general colorectal cancer screening guidelines or the personalized plan recommended by their doctor. We encourage you and your family members to keep in contact with their office every few years to learn about potentially important updates. If you have any other questions or concerns, call your doctor or the MSK Clinical Genetics at 646-888-4050.